COVID-19 pandemic, mucormycosis, the black fungus, maiming COVID patients in India. Mucormycosis is a very rare infection. It is caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It is ubiquitous and found in soil and air and even in the nose and mucus of healthy people. It affects the sinuses, the brain and the lungs and can be life-threatening in diabetic or severely immunocompromised individuals, such as cancer patients or people with HIV, AIDS and other chronic illnesses. This video is brought to you by HealthyRN Ways, that talks about COVID-19 pandemic. Videos will be posted every Monday, Wednesday and Friday. Please see my other videos at the description link below. Even as a deadly second wave of COVID-19 ravages India, doctors are now reporting a rash of cases involving a rare infection, also called the black fungus, among recovering and recovered COVID-19 patients. Mucormycosis is a serious but rare fungal infection caused by a group of molds called Mucormycosis and mostly affects the sinuses or the lungs. If left untreated for too long, it can turn fatal. Doctors believe mucormycosis, which has an overall mortality rate of 50%, may be being triggered by the use of steroids, a life-saving treatment for severe and critically ill COVID-19 patients. Steroids reduce inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronavirus. But they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic COVID-19 patients. It's thought that this drop in immunity could be triggering these cases of mucormycosis. Diabetes lowers the body's immune defenses, coronavirus exacerbates it, and then steroids, which help fight COVID-19, act like fuel to the fire. Mumbai, one of the worst-hit cities in the second wave, has already seen some 40 patients suffering from the fungal infection in April. Many of them were diabetics who had recovered from COVID-19 at home. 11 of them had to have an eye surgically removed. Between December and February, 6 in 5 cities, Mumbai, Bangalore, Hyderabad, Delhi and Pune, reported 58 cases of the infection. Most of the patients contracted it between 12 to 15 days after recovery from COVID-19. Mumbai's busy Sion Hospital has reported 24 cases of the fungal infection in the past 2 months, up from 6 cases a year. 11 of them had to lose an eye, and 6 of them died. Most of the patients are middle-aged diabetics who were struck down by the fungus 2 weeks after recovering from COVID-19. We are already seeing 2 to 3 cases a week. It's a nightmare inside a pandemic in India and around the world. Doctors say they are surprised by the severity and the frequency of this fungal infection during the second wave, compared to some cases during the first wave last year. Patients suffering from the fungal infection typically have symptoms of stuffy and bleeding nose, swelling of and pain in the eye, drooping of eyelids, and blurred and finally, loss of vision. There could be black patches of skin around the nose. Doctors say most of their patients arrive late, when they are already losing vision, and doctors have to surgically remove the eye to stop the infection from reaching the brain. In some cases, doctors in India say, patients have lost their vision in both eyes. And in rare cases, doctors have to surgically remove the jawbone in order to stop the disease from spreading. An antifungal intravenous injection, which costs 3,500 rupees, $48, a dose and has to be administered every day for up to 8 weeks, is the only drug effective against the disease. One way to stall the possibility of the fungal infection was to make sure that COVID-19 patients, both in treatment and after recovery, were being administered the right dose and duration of steroids, and none of them contracted the fungal infection. Doctors should take care of the sugar levels after the patients are discharged. A senior government official says there is no big outbreak. Yet it is difficult to say why a growing number of cases of mucormycosis are being reported from all over the country. The strain of the virus appears to be virulent, sending blood sugars soaring to very high levels. And strangely, the fungal infection is affecting a lot of young people. The youngest patient last month was a 27-year-old man, who was not even a diabetic. We had to operate on him during his second week of COVID-19 and remove his eye. Indian authorities warn of rare fungal infection seen in some COVID-19 patients as India grapples with a deadly second wave of coronavirus. Authorities have warned of a rare fungal infection that can maim or even turn fatal if left uncared for. Several media reports have said that doctors in the country are reporting cases of mucormycosis, informally known as black fungus, among recovering or recovered COVID-19 patients in states like Maharashtra and Gujarat as well as in Delhi. While the fungal infection is a separate condition from COVID, it is more common among people who have underlying health problems or are on medication that lowers their body's ability to fight germs. Researchers examining past Mucormicosis infections in India found that diabetes was the most common underlying disease, occurring in 54% to 76% of cases and even in an healthy and young individual. While the infection is treatable, the CDC estimates a mortality rate of around 50%, though it said that varies depending on underlying conditions, type of fungus and body site affected. But the state-run Indian Council of Medical Research, ICMR, said patients who have had prolonged stays in intensive care units or are immunosuppressed due to steroids can also be at risk. Many severe COVID-19 patients in India are being treated with corticosteroids like dexamethasone, an anti-inflammatory drug that also reduces the immune system's ability to fight infections and other disease to alleviate symptoms, making them more susceptible. What are the symptoms? Over the weekend, urging doctors and patients to look out for early symptoms. Those include nasal congestion and discharge, one-sided facial pain, numbness or swelling, toothache and loosening of teeth, blurred or double vision, redness around eyes, fever, breathing difficulties as well as chest pains. Treatment options include antifungal therapy, reducing or discontinuing steroids and other drugs that suppress the immune system, while in more severe cases, surgery may be required to remove all necrotic tissues from the body. If left untreated for too long, it can lead to permanent damage, such as loss of eyesight, as well as death. Mucormicosis was present in India even before the COVID-19 pandemic began last year. Official data is scarce due to the lack of population-based studies, but some researchers estimate the prevalence of mucormicosis as around 70 times higher in the country than the rest of the world. They're a family of fungus that gets into your sinuses and deposit there, and they can get into the air spaces in your head. And when your immune system can't keep them under control, they invade the base of your brain, where it becomes a real problem, and really very serious. You can also get the fungal infections in places where there's a lot of earth-moving building work going on, because it stirs up a lot of dust in the area. The fungal spores are usually inhaled, and while most people's immune systems can fend them off, people with conditions such as diabetes or leukemia that weaken the immune system, or those who take medications that lower the body's ability to fight germs, such as steroids, are prone to the spores developing into an infection. The condition is usually very rare, with about 500 cases a year estimated to occur in the US prior to the pandemic. The exact number is difficult to determine as there is no national surveillance for the infection. Why is it appearing now in India? COVID-19 was creating conditions for the infection to take hold. People's immune systems were being compromised by the virus, and mucormicosis was being seen in particular in patients who also have diabetes. We give a lot of high-dose steroids now to people with COVID-19 if they end up in intensive care, as the steroids help to treat inflammation, but the steroids unfortunately also suppress your immune system. So that's why we don't like giving steroids to patients longer than we absolutely have to. We're trying to decrease your inflammation with the steroids, but that actually means your ability to fight normal infections, like fungus, is also compromised. Health systems are under intense pressure in India, and crowded and cramped environments are giving it more chance to spread. How is it diagnosed? Symptoms include pain and redness around the eyes and nose, a fever, headache, coughing, vomit with blood in it, black and bloody nasal discharge, pain on one side of the face and in the sinuses, blackish discoloration over the nose, tooth pain, and painful and blurred vision. Fluid and tissue samples may be taken to confirm a diagnosis. How is it prevented and treated? Mucormicosis is expensive and difficult to treat, and has a mortality rate upwards of 50%. We usually put people with suppressed immune systems in what we call positive pressure rooms when they are admitted to hospital to reduce the risk of acquiring infections like mucormycosis, because by increasing the pressure in the room, so that the air flows out into the corridor, there's less likely to be fungus or other things circulating in the air that the patient can breathe it in. A positive pressure room is the last place you want to put a COVID-19 patient, as it can spread the virus, making mucormycosis harder to prevent. Patients with mucormycosis are given antifungal drugs that can be quite toxic. You invariably need surgery as well to clear out the source of the fungus, which is usually the sinus, and the back of your throat at the back of your nose. You've got to get in there and cut out all of the fungal material. That surgery can be in very delicate places like the base of your brain. The Indian Council of Medical Research and the Union Health Ministry have issued an advisory urging people to wear shoes, long trousers, long-sleeve shirts and gloves while handling soil, moss or manure. People should also maintain personal hygiene, ensure if they have diabetes that it is well controlled, and medical professionals should discontinue immune-suppressing drugs such as steroids as soon as they are able. We believe everyone deserves access to information that's grounded in science and truth, and analysis rooted in authority and integrity. That's why we made a different choice: to keep our reporting open for all readers, regardless of where they live or what they can afford to pay. This means more people can be better informed, united, and inspired to take meaningful action. In these perilous times, a truth-seeking global news organization like The Guardian is essential. We have no shareholders or billionaire owner, meaning our journalism is free from commercial and political influence. This makes us different. When it's never been more important, our independence allows us to fearlessly investigate, challenge and expose those in power. Please like, share and subscribe to my channel. Thank you for watching. See you on my next videos. Ma salama.